Thank you, Chairman. Thank you, ladies and gentlemen. Following on from Giovanni's Salti, we were just about to talk to you about the neck. The neck is actually quite an interesting area because that does show your beauty and age. We've looked at facial treatments, and we're looking at a new technique of injecting PROFHILO, which is biorevitalizing the neck, in a consistent format. We want to make sure that we can inject in areas which avoid potential injection-related adverse events, and allows us to have a consistent area to inject patients within our practice and also compare patients without the practice who've been injected. So to do that, we've developed, in conjunction with IMCAS, a neck injection protocol. In keeping with the 5-point or 10-point injections on the face, we will look at 10 points to inject the neck. To do that, we're going to look at anatomical areas that are fixed that will allow us to use areas to inject. So the areas that we are looking at are the angle of the jaw, the mastoid, the insertion of sternocleidomastoid, and then carrying that forward diagonally down to the sternum. So you're looking at the medial border of sternocleidomastoid. This is important because running along this line, you will have the external jugular, but it is subplatysmal. So all our injections have to remain preplatysmal, but make sure we avoid this area. So any injections we would do in this area would be lateral to this line, about 1 centimeter to 0.5 centimeter laterally, and be preplatysmal. So that's the lateral border indication. The midline border you need to consider are the area just below the chin, the mentum. We need to find the hyoid bone or cartilage, which is that sharp transverse point across there. The area between the mentum and the hyoid bone is an area where there's a preplatysmal fat and where the preplatysmal fat communicates with the postplatysmal fat. So injections in this area will allow you to get product not only in the preplatysmal area, but also the postplatysmal area. So that's a very good area to understand. As you come lower down, you're coming to the thyroid cartilage, and obviously in a man, you would have the Adam's apple along here, and then the lower border of the thyroid cartilage. And between that is the thyroid cartilage, the tracheal rings, and the sternal notch. So these are now fixed anatomical points that we can use for our marking. The markings are, the first point is between the mentum and the hyoid bone. So in the midline, in between the two. It relatively is between 1.5 to 2 centimeters in between that area. That area is about 4 centimeters in length. So there's the first point. The second point is taken as an area between the apex of the thyroid cartilage, the Adam's apple, and the end of the thyroid cartilage here. The reason that's used is if you have a prominent thyroid cartilage, any dispersion of material will be hidden by the prominence of the thyroid cartilage. That's point number 2. Point number 3 is between the end of the thyroid cartilage and the sternal notch. So in between the two, in the thyroid rings here. This is an area that is relatively safe to inject, again, staying preplatysmal. And point number 4 is in the sternal notch. So now we have fixed midpoint injections using anatomical landmarks as a framework that will allow you to consistently inject this patient every time you see her. Laterally, we come to the sternomastoid and the angle of the jaw, and we find a point that is in between the two and almost in line with the second injection point. So coming out laterally here. We stay lateral to that sternocleidomastoid point. Coming down, we come to the point of the number 2 injection here, which is between the prominence of the thyroid cartilage and the end of the thyroid cartilage. Come across laterally, and there is your point number 5. The last injection point on the lateral point is between the end of the thyroid cartilage and the sternal notch, which is here, which is point number 2, which we came, point number 3. We come across horizontally to come and inject in here. So similarly, we would transpose that marking on the other side. Let me just get the product and I'll show you how best to use this. Fortunately, the product comes with 2 needles. I tend to change my needles after every 5th injection. It's a very easy technique to use with the needles provided, which is a 29 gauge needle. It is longer than you would expect, so you need to use a technique to ensure you stay pre-platysmal. So we need to keep this needle in the pre-platysmal area. We will deposit 0.2 mils in each point. So the first point we will do, as we come, starting from laterally, just between the angle of the mandible and the mastoid, and just on the surface of the sternocleidomastoid. We will just carry on. That's fine. We will carry on with this at the moment. So, the best way to stay pre-platysmal is to lift the skin up in a fold. So now you are holding skin and fat only. The platysma is below that. It will not come up with this pinch technique. And then we want to insert the needle transversely across. And we want to then deposit our first injection, which is 0.2 mils, in the subcutaneous area. The first injection point here tends to swell up a little bit more because you have the parotid-auricular fascia or Furness's fascia, so you do get more prominence, but you can see already it starts to spread. Again, this is going to keep you away from the platysma and superficial to the external jugular vein. It's the one thing that we want to avoid when you're injecting. Finally, there is one way to make sure you are in the right plane is to put the needle in, and then if you can zoom in on here, if you can wiggle the needle around like this, just literally, that shows you are in the subcutaneous layer and not picking up or tethering the dermis. If you tether the dermis, you will end up with a little bit more of an intradermal injection, but again, do not worry. It will spread. PROFHILO has a great propensity to be able to spread intradermally. So these are the lateral injection points. I will work upwards for ease of demonstration here from the sternal notch upwards. Remember, in this area, you are medial to the anterior jugular veins, which will run in a paramedial section, but the sternal notch, be careful, there may be a communication between the anterior jugular, and sometimes you can see it, so stay very superficial, and this pinching technique is the best way to ensure you're safe, and go transversely across the skin. The little wriggle shows you're superficial, and then you can continue with a 0.2 mil aliquot that goes straight in the subcutaneous plane. Again here, a little pinch, pick the skin up, and that will make sure you remain transversely under the skin. Now that's my 5th injection point, and at this point I tend to change the needle. Does stay sharp for longer, but just for patient convenience, it is very good to good practice to change the needle. So we'll use the second needle that's in the pack and continue with that. By all means, do feel free to ask me any questions. I'm more than happy to answer them as we are injecting this technique. Again, pinching and laterally. This makes sure we stay well above the platysma, and in this area we are not going to cause any damage to vital structures below, particularly near the larynx. We're absolutely safe.
Excuse me, what's the strength of the product you're using?
This is PROFHILO, which is a mixture of a long chain and short chain hyaluronic acid. It's thermally stabilized, so there are no cross-links on that. And the strength is 32 milligrams per mil, which gives you 64 milligrams in 2 mils. So you're depositing 64 milligrams of what would be classically referred as a pure hyaluronic acid. There's no BDDE-related cross-linking at all. I'll just go to the other side to finish this off. So is that all right? Did you understand that?
Yes, thank you.
So we're just going to do the lateral side now. We've done the first lateral side, the midpoint, and you can come laterally. This is the corresponding points that we did in the last side. The important thing is to keep firm pressure. It's a little bit stronger, a little bit more difficult to inject because it is a stronger product, but you can get this through finer needles, but just you have to be careful that you fix the needle firmly on the lower lock so that it doesn't come off, and then you can carry on with your injections. So that's the lift that you need. You can see that just is skin and cutaneous tissue only, and we are in the subcutaneous plane.
Sorry, can I come back to the product again? Did you tell me this is not cross-linked? This is like using mesotherapy, or
no? This is cross-linked, but it's a thermal cross-linking.
Okay.
So it's a different proprietary chemical. It's a thermal cross-linking process. So it doesn't have any chemical to stabilize it. There's no cross-linkings like BDD or PVC.
Excuse me, I have a question.
Yes.
By injecting on the safe zones, are you going to get the result for the whole neck, like wrinkle areas? And because you're injecting on the specific locations.
Indeed. This is a very good question. This works in a different way to how we would look at a traditional filler. Traditional fillers tend to be very cohesive and stay in one place, having injected it. So you see these lumps. If I was to see that with a traditional filler, I would be very worried. I don't know if you can zoom in on that. But the whole thing about this is because of its very nature, it spreads in about a 4 centimeter zone laterally. By the time this lady gets home, this would be almost invisible. And there are some good studies that will show that the product will just literally spread to the different areas, and it spreads by about 4 centimeters. So if you draw a 4 centimeter disc around there, that's where it will affect it. So all of these areas, if you measure about 4 centimeters across, they all will cross over and will therefore affect and treat these.
Will you be injecting the same place again after a couple of weeks, or
in about 4 weeks' time, I would inject the same place again.
Okay.
You can. There are ways of going off-label, but I think in first starting using this product, stay in the same place, and you will see exactly where the product will spread to and affect.
Thank you.
Unfortunately, we didn't see when you just did one side. How many shots have you done on the left side now? If we got her to sit up, would we see any difference or not?
You probably won't, but let's just get her to sit up. It's very difficult. Come and sit up. If we look on this side, it's just been injected. You can see some lumps. I don't know, you can just about see them. They look like little bee stings. Okay. There are 3 injection points laterally. Let's just turn around here. If you look on the top, this is the very first area I injected here. That bee sting is beginning to almost disappear. This is less so. This is still a bit high. But they will really spread away. I don't tend to recommend that they massage it. It does tend to settle down very well. If patients are very worried, they can massage it. But obviously, there's a hole there, and we don't want to be introducing infection. So I tend to say to patients, leave this well alone. It will spread naturally. It's a very good propensity to spread. And there's some studies that look at the flow ability of this intradermally, and it does.
I have a question about the amount. You use 2 milliliters of the
the product. Yes, the PROFHILO comes in a 2 millimeter syringe, and we've developed this 10-point technique. For those of you who want to know the exact points, there's a very nice brochure that's available on the booth from IMCAS. You can go there and pick that up, and it shows you exactly where these anatomical marking points are, and each point is a 0.2 mil injection. So with this 2 mil syringe, you will be able to treat the whole of the neck.
When the patient will see the visual results of your treatment?
Right. The visual results you will start to see by about the third to fourth week. You will start to see some improvements. By the second injection, you tend to see quite a dramatic improvement. Occasionally, you may have to do a third injection. It is very dependent on how the patient's cells respond to this. This is a cellular process. This is not a process of just filling up and lifting the skin and just causing it to plump up. You're actually revitalizing the skin and causing the cells to start activating and start producing fibroblast activity. So you're increasing the collagen strength, and the skin elasticity is also improved. And that's why we see in those pictures in the brochure, you'll see when we treated it, there's this dramatic improvement, particularly of those folds you get on the neck submentally. The elasticity improves, and therefore it pulls the skin upwards and tightens that sort of dewlap effect of the neck.
I have another question, doctor. Can we use this product for other parts of the face, or just only for the neck, like under the eyes, or?
Right, you have to be very careful injecting under the eyes, but if you follow the 5-point BAP technique, the first point, which is here, there is spread across to that area. I would caution against using it for treating for tear troughs and those sort of dark circles. That's a completely off-label treatment and has not been properly studied, and I would caution you about using that. But basically, it is for biorevitalization, face, neck, and areas of skin. Let me just go off on a limb. It is when you want areas of skin that need to be biorevitalized, you can start using this, and it works really well in improving the cellular turnover.
Thank you.
How did that feel? Was that very painful? Any pain?
No.
She said, not at all. So you can see it's a very painless procedure. Just to inform you, this is a pure product. Please do not try and mix other things with it, because it doesn't have the chemical cross-linking that stabilizes it. If you mix other products, and by which I'm thinking about people may say, can I put some local anesthetics in it? Remember, that will change this product and can disrupt that cross-linking mechanism. So don't be tempted to mix other products with this. Use it as it is, and inject it slowly, and the patient won't feel any pain.
So you're using on an average then four syringes over a period of over a month or something. Is that correct?
That's right. Yes.
So what's the cost of that to the patient generally?
Do you want euros or pounds from my point of view?
Whatever you like. Let's go for euros.
Let's go for euros. Euros. Well, can I go pounds, because I'm British, and we although I don't agree with Brexit, let's go with pounds. Average cost, we're talking between in the UK, you're looking at between £600 to £800 for a full course of treatments, which is 2 to 3 treatments between 2 to 3 months. I think I've lost you.
No, that's fine.
You can hear you.
We're multiplying that out in our heads, but it sounds awfully cheap.
It is very, very cheap, isn't it? £800 to £900 to treat your neck and skin. I think it's a very good value product to use. You do need to have them buying into, excuse the pun, but buying into the treatment plan, and they have to explain that it won't be a treatment that works immediately. It is a course, but you do see after the first injection, particularly around if you're doing the face, the anterior part of the face and this lower part of the face, of the neck, I beg your pardon, improves almost dramatically after the first injections. As you become more proficient in this, you can start to think about where else needs treatment and use that in the areas that need specific targeted therapies.
Just one quick question. What's the maintenance on this?
I would probably recommend you see the patient at least on a 6-monthly basis to consider, and you would only then need to top it up with 1 injection. You don't have to go back to that 2 to 3 injections, and so it's not necessarily £600 to £900 every 6 months, but you can just probably get away with 1 injection.
Thank you much. Thank you very much. It's a terrific presentation.
Thank you very much, everyone. Have a lovely time at IMCAS.